Now, the academic training, of course, already occurs at the university. I might be asked to do something like discuss how a particular therapy could be applied to a case. So that's helping them in the practical sense to integrate theory with practice. But the phases are excitement a bit, fear a bit, oh my gosh, a real client, oh, what if I don't know what to do? You know, it's no different. It's no different from anything that people are trying for the first or second or fifth or 10th time and really want to do well in. So part of my role as a supervisor is, number one, if I'm supervising somebody doing prac with a client, it is always, number one, that client's best practice experience. Their safety, their health, their best practice experience. So that is the number one focus. Then with the client, with the student, it's encouraging them. And maybe just doing some briefing beforehand. Well, we've got a next patient or a next client, and I know that that person is going to come to you with some relationship or anxiety issues. As the supervisor, I will want to know the context of that person so that I'm sure that the clinical practice approach, where the student's skills get an opportunity to be practiced, but the student isn't thrown, even if the student's a doctoral student or a diploma student, the student isn't thrown into a situation where they've absolutely never met that and it's way beyond what they'd be asked to do. So I do a little bit of filtering. I do some due diligence for a reasonable match-up of at least the subject between the client and the student, and then they have the best experience. I'll encourage that student, and we might have previously done some role plays either with other graduates or students or myself as to how they might greet and introduce somebody, etc. And as we're going then, I'll do the observation. I will already have both, obviously everyone's permission that we are doing a student practice process, but equally that if there is something critical to the client, that with full respect to that student or graduate or supervised qualified person, that I will intervene respectfully and appropriately. And our rapport to be able to do that's very important. Now sometimes, actually a lot of times, the person I'm supervising says, thank God for that. You know, so they're grateful to know that they're going to be able to easily flow, and if there's a moment where they're not sure or somebody says something that they've got no idea about or it's a bit breath intaking, they're not going to be stuck there not knowing what to do. That I'll just easily, like a bridge, move that through and invite them. So I'm thinking, an example might be, somebody says something and let's say the graduate isn't sure how to respond to that. They will have the opportunity to do it, and if not, I might just say, so client, from what you've said, and I might just do something simple that isn't necessarily an intervention, but it just might be reflective listening. And while that's happening, the qualified person is having a little opportunity to tick through a little bit. I might say, so what, did I get this right? What you're saying is to do. And in relation to that, you've tried, and I might just, that person's thinking. Now, if they still can't move on forward from that, I might look at them and say, let's call that person Jan, right, the graduate. Jan, is it all right, do you mind if I make a suggestion here to client just at this point? So they're not on the spot and everything flows beautifully. Now that's a different skill. The skill of supervision is a different skill, but the reason I explain that is yourselves as university students or as fresh graduates or persons coming into the profession, when you are engaging with your supervisor, you've got the right to expect a degree of quality supervision for two reasons. One, that you feel comfortable and then can begin to develop your psychology and counselling skills. You want to feel that you can actually do that whilst learning. And secondly, you want somebody who's going to be able to model for you appropriate ways to engage with the client. So you've got the right to talk to your supervisor about, strategies of supervision. You've got the right to talk to your student about things that might, your supervisor about things that might worry you, or alternately things that you're feeling really comfortable with. And you might negotiate with that supervisor and say, I feel really comfortable when it comes to giving advice around stress release, or how to tone that down and become calm. So if that's mentioned, thank you for your input, but I'd really like to be able to handle that aspect myself. So I like to have this conversation beforehand with the person, the graduate or the student, and in that way, whatever may have been a fear, I'm hoping they'll go, oh, that's good then, good, we know how that's going to work. And then, feeling more confident, you can go forward and you can have the very best prac experience and then deliver the best counselling to the client. So, fears, things that people worry about. What if the client says something I won't know how to respond to? So I've covered that. That's how we deal with that. What if something comes up and I'm affected? So again, I like to go through these subjects before I put the client and the graduate or the student together. And if that does come up, it's the perfect opportunity, using the same philosophy, it's the perfect opportunity for a debrief afterwards, given that in the supervisory prac scenario, I'm there anyway, and everything's going to go well while I'm there. Or when I say myself, I'm talking for me, your supervisor. So when your supervisor is present, you can relax because you will have the quality control of the experience. And things will come up. People have had experiences in their own life and have chosen to become psychologists, counsellors, and then somebody else will share that they've had that same experience. And I've had it said that people said, but I just froze because I was in the grief. I didn't realise that was going to come up for me. Best that happens, if it's going to happen at all, in the supervision process. And if anything comes up, or you know or imagine beforehand that this is going to be a stumbling block, it's your responsibility to be very clear with your supervisor that this is something you need to have a consultation about yourself, some professional input and guidance before you get in front of a client. If you weren't sort of certain that it would come up and it did, let your supervisor know within the session that it would be fine for them to continue with the client, and absolutely ensure that you're debriefed. Now, just because you do psychology and just because you're a graduate, does that mean you're impervious to everything that's happened in life and all of a sudden you are the Zen master? No, it does not. It does mean, however, that your awareness of any areas of inappropriate vulnerability in the professional context, that your awareness of that has to be available to you, and that's your responsibility. That the processes to move through that and gain your skills, such that should that happen again, should another client come with a similar experience, that you are far more engaged with the client and giving them best service. That's your responsibility. So part of being a psychologist is your focus on the client's massively best interest. And that's your number one focus. Now, through that journey, the benefit's going to be that if you've got a few wobbles going on, you will have the opportunity to get expert input so that you yourself have more clarity and more strength and more choice around that in your individual life. But in my world, the interest, the safety and the highest quality service of the client in the professional setting is number one. And as a psychologist, you must do whatever it takes, professionally, healthily and responsibly, to be the best person in that setting and to be available to the client at that level of expertise. And that's about it. You know, I actually personally don't encourage anything less than that. And that's what your practice is for. That's what your clinical practice is for, to use it.